everyone. Happy Wednesday. I almost said happy Monday. The week's going by so fast. I don't know what day it is half the time. But thanks so much for joining me for our weekly live for Better Balance, Better You. And tonight we are talking about knee surgery and the different implications related to knee surgery. Hey, Nicole, thanks for watching. So that's what we're going to talk about because this was a member's request this week. So I sent out a message and I said, hey, what do you guys want me to talk about? And this was the subject. So for those of you who are new to the group, my name is Monica Tillett. I'm a physical therapist and the owner of New Direction Rehabilitation, and my goal is to help people get their balance better, but there's so many factors affecting balance, and your knees are one of them. So let's talk about knee surgeries. And for those of you who come on throughout the video, just comment, let me know, hey, I'm here. Or if you're watching a replay, let me know that you've watched a replay. And of course, ask any questions. But so knee surgery is something that is very common, and there are different types of knee surgery. And part of it is because you either have arthritis and your bones start rubbing against each other because that fluid in between the bones aren't there as much as it used to be. It's not as abundant. So the knees, the bones start rubbing on each other, and that causes pain. Or it could be maybe you've injured yourself and maybe you've fallen down and you've injured the ligaments that are in and around the knee. So that can be another reason why you have knee surgery. Hey, Mom, and hey, Lena, thanks for joining us. And so the doctors will look at your knee and they're going to determine, okay, yes, we either need to do a full replacement, which means that they're going to shave off a little bit of each of those bones and then put a metal plate over that bone so the bones can glide against each other again. Or they'll do a partial replacement, which means they're just going to do that to one of the bones. And sometimes you may hear people say, oh, my doctor just went in and cleaned it out. And all that means is that they just go in and there might be loose debris around the knee that could be hanging off. They just go in and just clean it out to see if taking out some of those extra particles can help decrease the pain and help your leg work better. So just know that there are different variations, but your doctor is going to look at your medical history, and he's going to do an x-ray and determine if a knee replacement or other type of knee surgery is warranted. Hey, Shelby, thanks for watching. So everyone, with that being said, is not a candidate for knee surgery. So it's either one, your knee pain has gotten so bad that you can't function from day to day with your normal activities, or the damage to the knee is causing instability. So maybe your knees are buckling a lot and you're having a lot of balance issues. Or it could be that you have a lot of medical conditions going on that the risk of having the surgery doesn't outweigh the benefits of having the surgery. And so I have had people, actually I had a neighbor where he was on a lot of blood thinners. The doctor didn't want to do the knee surgery, and he had serious balance issues, and he fell down his basement steps and he broke his hip, and the doctor had no choice but to do a surgery, which he didn't want to do in the beginning, but he had to. That now the risk didn't outweigh the benefits in that situation. So just know that it's not for everyone. Hey Edith, thanks for watching. So definitely, if you're wondering, is a knee surgery something that I need? I'm in a lot of pain, I'm not moving around, then consult your doctor. You guys go through your health history and your limitations, and he's going to do an x-ray and then decide whether or not that's going to be something that is right for you. So another condition that comes along with knee pain and arthritis and surgery and all of that is swelling. And one of our members asked about anti-inflammatory medications. I can't say that those are medications that you need to take or should take legally, but all I know is that your doctor, if he feels that it's something that you need to be on, an anti-inflammatory medication, and he will prescribe it, but everyone can't take them based upon their health condition and other medicines that they're taking. So don't just go taking medications that you haven't discussed with your doctor first, because it could cause some serious effects if you do. But if you are having swelling that is affecting your movement and it's causing pain, then you can put ice on your knee, and you can do that for 10 to 15 minutes, every hour if you want to. Hey, Miss Delphine, thanks for watching. So you can, ice is great alternative to, certain medications to help with swelling. So ice 10 to 15 minutes on that knee every hour. Or, don't have to be every hour, it could be every few hours. It's up to you and what you can tolerate. And then also, elevation helps with that swelling. Okay. So a lot of doctors recommend physical therapy for those patients who they might think need knee surgery, or, and before and after, let's put it that way. So if they think that you're going to need knee surgery, they often do therapy to strengthen those muscles around the knee. And then, of course, you're going to do therapy after the surgery. And that's important before any type of knee surgery to see if that helps with the pain, because you have to have the muscle strong around that joint. And it's also good to strengthen all of the muscles in that leg and not just those around the knee. So, hey, Becky. So, definitely try gentle exercise and strengthening first, and then, consult with the doctor and let them know if it is or is not helping. And then after, if you do need knee surgery, then you most definitely have to have physical therapy to help move you through that rehabilitation process in order for you to progress and get back to a normal way of moving. So actually on the 6th of May 6th, I did a video on some different knee exercises that you can do, and just gentle exercises in general that can help strengthen the knee if you're having a lot of knee pain. And then I also uploaded on May 12th a PDF form of those different exercises that you can do. So if you want to reference some exercises, if you're having knee pain, then go back to my video on 5/6, and then also look at my PDF file that I uploaded on May 12th. Okay, and you can see those things. And tomorrow and Friday, I will post some additional exercises that you can do if you're having knee pain and you're wondering if you need knee surgery and you want to try doing some exercises to help with that. So I will definitely post those. But before I get off, the last thing I want to talk about are the risk factors the risk factors of having knee surgery. So, of course, you know, with any surgery, there's pain and there's risk for infection. So you want to make sure that you are icing and making sure that the area is very clean if you have a surgery. And then also another major risk factor is blood clots. Anytime you have a surgery, blood clots can form, and most of the time the doctors will put you on a blood thinner to help prevent that, but it doesn't always keep them from forming. So you have to be very, very careful if you're noticing extra swelling or redness, or even warmth in the area where you have had knee surgery. Then you want to call your doctor immediately. Don't brush it off, because it could be a warning sign that it is a clot there. So just keep that in mind, that while knee surgery is very beneficial for many, many people, that you still have to, you know, work through the rehabilitation process and be careful and observant and make sure that there aren't any complications. And the last thing that I want to bring up is you want to make sure that the doctor who is doing the surgery, ask around, see if you know anyone who that doctor has done surgeries on, you know, before, and ask them how they liked it. How did their knee do? Because the doctor and their techniques, it deals a lot in the rehabilitation process. So it's good to go with someone that you know has done a great job and has a great reputation. Hey Deb, hey David, thanks for joining. And just kind of talk with someone else who's gone through the process to see if, you know, if that doctor is the right fit for you, and also go and talk to the doctor and see if he's the right fit for you, if you don't know that doctor, okay? But if you know the doctor, which most of us do have a doctor that we have grown to have a good rapport with, then, you know, those are great people, you know, to get you through those surgeries and things that you need. So if you have any questions or concerns, if there's something I didn't touch on with knee surgery, you can comment below or send me a message. And David, I know you see a lot of patients who may have had knee surgery. If you have any other helpful tips that can help anyone, that will be great. But I will definitely post some additional exercises in a group so you can see. And if you have any questions, if this made sense, just comment, yeah, that makes sense below, or comment your question for me. But just know that you have to be proactive in your health, and you definitely, people kind of don't think that strengthening and moving our muscles are as important as maybe doing cardio or other things of that nature, but we have to have strong muscles to support our joints, you know, and our bones in general. So strengthening is going to help a lot when it comes to either pre-surgery or post-surgery. So thanks again, everyone, and have a great rest of the evening and a great week.